Lots of good things happening at CHEO, and the president and CEO of the Children's Hospital of Eastern Ontario is here with us this morning. Alex Munter, how are you?
Good morning, Kurt.
Good to see you.
And good to see you.
You guys are making great advancements in a number of areas, but we're going to concentrate on mental health right now, and this has been a focus in this community of ours for the last couple of years. You have responded in great ways. You're launching a new website, correct?
We are, and you know, we've seen at CHEO this huge surge in demand for the mental health services, and it's a good news, bad news story.
Right.
A good news because as the stigma around mental health recedes, because we're here talking about it, because the community's talking about it, the message is seek help. And so the good news is people are seeking help. Now that's putting a lot of pressure on the resources of CHEO, of the Royal, the Youth Services Bureau, all of the agencies that work so closely together to deliver child and youth mental health services. And so we've seen a big increase, for example, a 50% increase over 2 years in the number of crisis visits to the emergency department, and a real desire on the part of parents and the community broadly to have more information and resources. So we're responding in a couple of ways. Obviously, we're putting more people at the front line, whether that's nurses, crisis workers, recruiting new child psychiatrists, trying to work as hard as we can to keep up with that demand.
Right.
Unfortunately, wait times are growing.
Yes.
But the other thing we're doing is this website that we launched yesterday, which is for kids, for parents, and it really takes the expertise that's in the building, because CHEO has some of the internationally recognized experts in child and youth mental health, and takes that expertise and puts it online.
We're looking at the website right now. What's
so
the best part about it?
There's a couple of our docs there. You've got Dr. Gandhi and Dr. Ritchie, and they've got an Ask the Expert section where you can ask a question and they'll answer. And if you have that question, somebody else may as well, of course. They've got short videos, about 30 videos on frequent topics. So parents are concerned and kids are concerned. And the idea, our folks in mental health, the idea came from the fact that over the past year or so, CHEO's been doing a bunch of community sessions, info sessions for parents. And people were hanging from the rafters, coming by the hundreds. People wanted the information. They thought, well, how can we make this information, this expertise that CHEO has, because CHEO really does have expertise in this area, how do we make that available?
I think that's one of the issues that face a lot of parents and, in turn, young people, is that there's a lot of information out there, Alex. There's a lot of places you can go to talk to somebody, but it's knowing that and thinking to myself, maybe the Children's Hospital will know what avenue to take in this particular situation, be it parents or children or young people. And I think this really points them in a solid direction, because there are other facilities and other people you can go talk to, and you know of them. You worked with the Youth Services Bureau for a couple of years, right?
For 4 years.
So you know. But at least being able to point someone in the right direction and get them on track is a bonus to, I think, a lot of people right now. And I'm no doctor, and neither are you, but we both know that we're seeing more and more mental health issues in younger people. And that's why CHEO has got to get involved in a big way, right?
And CHEO is on the front lines of this surge. And so whether it's in terms of prevention and working with children and youth, crisis intervention, programs in the community and outpatient services, so the whole range of services, CHEO is involved, working closely with the Royal, with community agencies like YSB. But what's happening is there's no evidence that there's a greater amount, a higher prevalence of mental illness. What there is evidence of is that people are seeking help, that the conditions that will go years and years and years, untreated, undiagnosed, people going without help, they're now seeking help. And so I think as a society, we have a job to do to step up to the plate, because 70% of mental illness has its onset in adolescence.
That's
so if we can intervene early, if we can make a difference for those young people, we can change the entire trajectory of their lives.
Well, good to see CHEO taking the lead, as per usual.
Well, good to see you.
It's really phenomenal what this hospital does.
It's a great place, and the folks in mental health, from the psychiatrists, psychologists, social workers, the nurses, everyone there, so committed, so caring, and really wanting to make a difference.
CHEO.on.ca/mental health. Go check it out. You'll be glad you did. you'll know it's there, and that'll be helpful in itself. Alex Munter is the President and CEO of the Children's Hospital of Eastern Ontario.